All right, Saagar, what's on your radar?
Well, there's been a lot going on in the news the last 2 weeks. So much so, it seemed to have made many of us think we're not actually in the middle of a global pandemic. Protesters took the streets for what they felt was a righteous cause, implicitly arguing that the cause that brought them out of their homes was worth the risk of getting coronavirus, an argument that was similar to many of the lockdown protesters, who rightfully pointed to the number of deaths of despair that are heavily correlated with economic depressions. The difference in the media coverage, the wokeification of the medical profession, and the broader failure of our public health institutions in this moment has profoundly failed all citizens. We don't yet have enough real-time coronavirus data to say whether the widespread protests that we saw in the streets will lead to an overall aggregate increase in coronavirus cases. But there are some troubling signs that it will. Yesterday, McClatchy reported that some members of the National Guard deployed to Washington, D.C. at the height of the protests have now tested positive for coronavirus, and presumably these guardsmen have access to much more testing capacity than the general public, and it could be a leading indicator of the evidence that some coronavirus spread at the very least occurred over the weekend. Now, local coronavirus reports also indicate that Memorial Day weekend gatherings weeks ago led to a temporary spike in coronavirus that we're now only seeing in the data. So as a matter of public health, it is impossible to look at the protests and say that they will not contribute to, at least in some way, to some rise in coronavirus. Now, that's not me saying this. It's also Dr. Anthony Fauci, whose every word and pronouncement was once treated as gospel in this nation just a few short months ago, when it seemed that he was disagreeing with Trump. So let's take a listen to his warning from the weekend.
Well, what runs through my mind is what does every time I hear about or see the congregation of large crowds at a time and in an area, a geographic area where clearly there is active infection transmission. It's a perfect setup for further spread of the virus in the sense of creating these blips which might turn into some surges.
Now, I present all of this as somebody who both respects and believes the argument. There are some things other than not getting sick which are important and should be weighed by citizens as they choose what type of behavior to engage in. But the key point there is that it's up to us as citizens to make our own minds up with the available, supposedly impartial information that we have before us. Instead, what we were bombarded with throughout the protests was complete and total hypocrisy by a medical establishment that has been overtaken by woke politics. Take NBC News medical contributor Dr. Vin Gupta, who, while speaking of the most recent protests, told MSNBC that racism kills more people than coronavirus. Therefore, social distancing didn't really apply.
We want, as much as anything, for social justice to take the center stage, because poverty, racism, they have actually bigger killers than coronavirus by the statistics. So this is the right thing to do.
Now, compare that to Gupta's comments just a month earlier when Republican governors wanted to reopen their states, arguing that economic destruction has to be balanced with coronavirus.
There is no data to drive what these governors are doing in these spot places across the United States, and there's no pop-off valve. I get it if we had a therapeutic that looked like it was really going to work. We don't know that yet about remdesivir. We definitely had a vaccine in 6 months, or if we had more ICU beds, places where I work in the ICU, because if we got it wrong, at least then we had a solution. We don't.
Different tune, huh? Well, it's not just Gupta. Jennifer Nuzzo, a literal epidemiologist at Johns Hopkins University, tweeted, quote, "We should always evaluate the risks and benefits of efforts to control the virus. In this moment, the public health risks of not protesting to demand an end to systemic racism greatly exceed the harms of the virus." The tweet comes shortly after a graphic was widely circulated, including her saying, quote, "I stayed at work for you. Please stay at home for us." Obama's former CDC director, Tom Frieden, he was also one of the most vocal advocates for people staying at home for lockdowns until the protests struck. Governor Whitmer of Michigan, one of the most vociferous in deploying law enforcement against citizens who dared question lockdowns, supported the protests, despite calling lockdown protesters political actors at the time. None of this is even to mention the endless media coverage, hand-wringing about the lockdown protests, featuring doctors and officials and epidemiologists that disappeared overnight the moment a cause that they agreed with took to the streets. Their hypocrisy knows no bounds. But worse, it demonstrates a bigger warning to us all. The people tasked with literally keeping us from getting sick are just as ideological actors as your average member of a Brown University College Democrats. They cannot be trusted ever again. If we have a second wave and they ask you to stay inside, are you going to do it? I don't know about you. I'm going to think twice about it. We can't trust the Chinese-infiltrated WHO, can't trust public health authorities, can't trust scientists, can't trust anybody to be sincere, because we know that they have the clearest evidence that we need, that they only care about science as a tool of advancing their own political power and agenda. And that was something that really bothered me about this, Crystal. Like the whole racism kills more people than coronavirus. It might even, however you want to define it, might be true.
Yeah.
But nobody said the same thing when people were talking. We were talking about on the show having compassion for lockdown protesters and giving true validity to the idea, the thing that we know on this show, which is that economic destruction has real-time impact on people's lives. Suicides in Northern California appear to have outpaced coronavirus deaths. Addiction, who knows how many people fell off the wagon and were doing well in the middle of this. Substance abuse all the way up, drug use, alcohol, everything. And yet, none of that was counted as enough for the medical profession, actual epidemiologists.
Right.
And then a cause that they agree with takes to the streets. And look, I accept as a citizen that there are things that are more important than not getting sick and that we can go out there and protest. I think it's fine. That's a logical judgment for us to make as free people. But that's not the job of the medical profession. The job of the medical profession is to tell it to you like it is and not have selective partiality whenever it comes to their political causes.
I think that's an important point because, look, ideologically, I agree with them that, to my view, this cause is more important, more significant, justifies, people in the streets. I would not have been there with the anti-lockdown protesters. That's not my cause. But we tried very hard on this show to understand that if you are taking this action of going out and knowing that this is a risk to yourself and potentially to your family as well, that there must be something driving that is really important to you. And, something that Irami talks about, which I think is an important note here, is that, look, again, this is not to equate the two protests or say this one is more just than that one, although I happen to think the current protests are more important and more just. But both groups were fighting for a way of life.
Yes.
That was very important to them, right? So important that they were willing to dispatch with that health guidance. It's not like not like we don't know, right, that there's a risk involved here, and take to the streets anyway. And so I think your point about if you're a medical professional and your job is just to deal in the science, right, then you have to stay sort of in that neutral lane because otherwise you lose people's trust and credibility. And so next time you do go out and make a recommendation, people aren't going to see you as a neutral actor. They're going to see you as a partisan actor. Now, I think within the health profession, like outside of the pundits, the health pundits on TV, just like this weird elite of the health profession, much of the care work that is done by working class people, disproportionately really black women, who have had a lot of affinity for the protests as well, who've been in the streets getting applauded and supporting the protests, which I also support. Like that is their First Amendment right, and they're down with the cause. And so I think that part of it is you've got two pieces. You've got like the medical professionals on TV punditizing, and the officials, the government officials, who are Dr. Fauci being pretty straight, frankly. I think he's actually done a really good job of being neutral in both of these things. But then you also have broad support within the care profession, which is also, I think, important to note. But your bottom line is just like, let's be equal treatment.
Yes.
Let's be clear about what the data is and what it says. Let's be clear-eyed about the fact that you're taking a risk and you acknowledge that and you understand that when you're going out into the streets. I think that it's not more complicated than that, really.
See, that was really what, drives me nuts is watching the way that they treated these lockdown protesters. And look, some of the lockdown protesters, AstroTurf, Koch brothers, all funded. Yeah, it's all true. All of it's true. But there's some people there because they wanted to be there.
Yeah.
And these people were treated, Governor Whitmer calls it a political rally. Does she call the BLM protests a political rally? I mean, it basically is. But, fine. Okay. Again, I give equal weight to citizens in what they believe is a righteous cause or not. I have no problem with that. And, when you come to it, when you have actual epidemiologists and doctors, Jennifer Nuzzo, those types of people, and they're the ones saying, I stayed at home for you, please stay at home for us. But now they're like, oh, no, on this one, you cannot discount how much of a damage this will be to public health guidance overall. If there's a second wave in this country, and actually I saw a chart which almost perfectly tracks our coronavirus cases with the Spanish flu, and we're right around that period, right now before a 2-month massive spike in the Spanish flu. I'm not a scientist, an epidemiologist, I'm just a guy on Twitter. But I was like, wow,
That looks bad, yeah.
Look, if that second wave comes, I'm not going to trust these people. I don't trust them for 1 second we see this in the data, all this stuff, because I know that you're just as partisan political hacks. Like I said, you have the same racial politics as some kids in college. And so if you're out there saying, it's fine to go dance in the streets, like we saw in some of these protests, but if you're out there and you're protesting lockdowns, I don't trust you. And neither is half the country, who also, by the way, happen to sympathize with a lot of these people.
Yeah.
You can see the public opinion on lockdown in Pennsylvania and others dramatically shifting after the protest. Shocker, right? They see all these people in the streets.
I think part of what we talk about on this show, and part of, frankly, why as many people have been excited by the show and interested in the show as is the case, is that you see that hypocrisy all around. So, on the left and on CNN and MSNBC, these protests are great, and let's stop talking about coronavirus, and it's all good, and don't worry about it. And these ones are horrible. And let's, by the way, find the worst people we possibly can and elevate them as if they're the face of everybody involved in the protests, right? On the right, meanwhile, you saw during the anti-lockdown protests, you saw a celebration of a sort of civil disobedience of opening restaurants in defiance of what was the law. But then when it comes to things like violating curfew, then suddenly, with these protests, then suddenly it's bring in the tear gas, bring in the rubber bullets, they get what they deserve. So there's hypocrisy all around on the treatment of these protests. And look, I always try to err on the side of, I think what makes this country great is our First Amendment rights, that people can go out in the streets, that they can express their views, whether they're popular or unpopular or not, and ideally not get shot with tear gas or rubber bullets or be vilified on any of the cable news channels. So that's the attitude that I try to take to any of these protesters who are taking time out of their day, out of their lives, taking risks themselves to go out and fight for the life that they believe in.
Exactly. That's really what it's all about. But, the medical establishment has chosen a different route. All right, I'm looking forward to your radar next, Crystal.